Okay, so wrapping up the cardiovascular system, I apologize for missing class once again. Um, but if you take a look at our little schedule at the board, you'll see what's going to be going on over the next couple of days. What I'd like you to do today in class is watch this video and then spend some time going over the review packet. Tomorrow we'll review, take any questions that you may have over what you're seeing on this video. I'm going to move the heart dissection back one more day. I apologize for that, but I want to have all this information in before we do it. And then we'll move to the test on Thursday to wrap up the quarter. So, what do we have left? We left off talking last week about arteries versus veins and systemic versus pulmonary circulation. So, now let's talk a little bit more about the heart itself. What is it made of and what's it composed of? So, the first thing I want to talk about is this thing called the pericardium. If you go all the way back to the beginning of the year, we talked about the different membranes that cover organs and cavities. So you remember words like the visceral peritoneum or the parietal pleural membrane, those sorts of things. So this is very much related to that. And let me pull up my little pointer thing here. I'll try to point these things out for you. So first thing we have is the pericardium. The pericardium is the protective covering of the heart, and there's different layers of the pericardium. And this is, again, something we talked about at the beginning of the year. First, we have the parietal pericardium. This is the outer layer. So if you remember, parietal was the membrane that covered the cavities. So the parietal pericardium is going to be on the outside. So I have it right here. And there's actually two different layers of the parietal pericardium. In between the parietal pericardium and the visceral pericardium, I have a little space. Again, anytime we say we have space in the body, it's not open space. It's filled with fluid, but that space is between the parietal and the visceral pericardium here. But that's filled with this fluid called pericardial fluid. Okay, pretty appropriate name. Then I have the visceral pericardium, also called the endocardium. This visceral pericardium is like suction cupped to the outside of the heart muscle. And we're going to talk about that heart muscle in a minute, which is the myocardium. So I have visceral pericardium, a little bitty space, and then the parietal pericardium. If you ever heard of this term or anytime we see itis, ITIS, it's always an inflammation. So if there's something called pericarditis, that is inflammation of the pericardium. So what are the remaining layers? So, and if we go back all the way to the beginning of the year, I'm not going to put this on right now, but the fibrous pericardium was that third layer or membrane that surrounds the heart. And we said that was the thicker layer. Okay. So I have once again, a little review: visceral pericardium, pericardial space, parietal pericardium, and then the fibrous pericardium or fibrous layer. So 3 layers around the heart because it's pretty important. So now layers of the heart itself. I have the epicardium. This is the outside layer of the heart. I have the myocardium. Myo muscle. So that is the muscle of the heart. It makes up the bulk or most of the heart and the what's the word I'm trying to say here? The most of the mass of the heart, I should say, is made of the myocardium. And then the endocardium. This is the very inside layer. So right here, think of you have the atria and the ventricles. The endocardium is basically the spot or the layer that is facing the atria and the ventricles. Okay, so you can zoom in on these things and see where they're at. But you see, I have the different layers of the pericardium right there on the heart. Uh-oh, what's going on my clicker? There we go. So now we know the layers, we know the muscles, but how does the heart muscle get blood itself? So the aorta takes blood all the way, to the whole body, but we still have to supply the muscles of the heart with blood, oxygenated blood, in order for it to or in order for it to work. So how does it work? So I showed you this last week, but we have these things that branch right off of the aorta called the right and left coronary arteries. They carry oxygenated blood to the myocardium. From there, those coronary arteries are going to branch. Okay, we've talked a lot about how large arteries turn into smaller arteries and then even smaller, and so on and so forth. Same thing happens in the heart. The coronary arteries are kind of branch, and you'll see these little branches or tiny itty bitty arteries going to the muscle of the heart. From there, it turns into the capillaries. The capillaries are just embedded in the myocardium, the muscle of the heart, and that's where the exchange of oxygen and carbon dioxide happen. And then finally, after the capillaries, we're going to start returning deoxygenated blood back to the right atrium. Okay, so that starts with the cardiac veins. So think of that first two steps are taking blood away, oxygenated blood away from the coronary arteries, or excuse me, away from the aorta into the coronary arteries. And then finally, we're starting to bring deoxygenated blood at number 4 back to the right atrium. So we have cardiac veins. Um, Cardiac veins carry it to this thing called the coronary sinus. This is on the back side of the heart. In this little groove called the atrioventricular sulcus, which is a very weird term, but think of atrio and ventricular between the atrium and the ventricle. There's this little thing back there that's going to accept this blood, and finally it's dumped into the right atrium. The oxygenated blood returns to the right atrium, and we start the whole thing all over again, very similar to what we had with pulmonary versus systemic circulation. There you go. See a sulcus. That's a groove on the heart. I have two sulcuses, or sulci, I guess, on the back of my heart. We'll see those when we dissect on Thursday. You see here, I have my coronary artery branching off of the aorta, and it starts to um, turn into smaller and smaller arteries. Now, there's a lot of other things I can go over in here, but for the main part for us, we're just worried about coronary arteries, and then we're going to start returning those using cardiac veins heading back to the right atrium. And I'm going to stop this video right there, and you'll see this on video number 2.